We're going to discuss quadrants. This is a bread and butter test in manual therapy, um, but it's not used very often by most practitioners for some reason. However, let me give you some examples of where it is used, and the therapist may actually not know they're doing quadrants. The hip scour test and Faber's test are both quadrant tests, or at least they're parts of quadrant tests. Usually it's just a position, the scour says you're moving a bit, and that's 1/4, depending on how much you move it, but that is 1/4 of the total number of quadrants in the hip. Similarly, Faber's is a position taken up in part of the outer extension quadrant for the hip. So they're using these tests, which are parts of quadrants, maybe without knowing that that's what they are. So what is a quadrant? It's the functional ovoid of motion of the joint. Now, the ovoid of motion is the extreme perimeter of the combined movements. Now, you can have functional combined movements and non-functional combined movements, but the quadrant uses the functional combined movement. So, for example, the shoulder, this would be two of the quadrants in a flexion, this way and up through there, and then you'll come back into extension, back that way. So there's 4 quadrants right there coming up. So this is the functional ovoid of motion. To do the test, it is full range. It's very strong full range as well. In the hip, for example, you even apply compression to stress it out a little bit more. And what you're feeling for is a normal ovoid, which means you have to test a few to know what is normal. And you just run the joint. You basically have two of the movements taken up, or whether it's 3-degree of freedom or not. Let's take the elbow. So if I wanted to check the outer flexion quadrant, I'd supinate it and then abduct it and then run it into flexion like so. But you're right up against the ovoid constantly, and you're feeling either for a deformation of that ovoid or for the reproduction of pain. They are both positive quadrant tests. The tests are very sensitive, but not very specific. So they make a really good screening test. If you're thinking there's a problem coming from that joint and you do these tests and the tests are negative, then you can pretty much say the joint's not causing the patient's symptoms or involved in the patient's symptoms in any way. On the other hand, if you're looking at it being part of it, and essentially you're getting positive a test from this, you can then say, well, the joint's involved, or at least it's symptomatic, but you can't say specifically where it lies, where the involvement lies. Is it the only source? That depends on the pain coming out. Is it an etiology? You don't know. All you're saying is the joint is abnormal and needs more looking at. So it can be used for exclusionary differential diagnosis and inclusionary. Okay, so let's have a look at more specific uses for this. As we say, it's a screening test. And as a screening test, I can use this for generating a hypothesis. I list out a bunch of differential diagnosis as possible first hypothesis. And if they include joint problems and I want to eliminate them, I'll do a quadrant test with them. So if that test is negative, I can eliminate that as the problem that the patient is suffering from. So it's very good at eliminating things. On the other hand, you may want to include things if you're using this as a method diagnosis. So you do the reverse. If you have a positive test, you can say that the joint is a reasonable candidate for being a possible diagnosis for the condition. So we can screen it out and we can screen it in, exclusionary and inclusionary differential diagnosis. We can use it also to reduce bias and error by doing exactly the same thing. we come up with a provisional diagnosis. We want to make sure that this isn't loaded up with error. So again, we'll make up a list of differential diagnoses. And the easiest thing to do is to eliminate those as potential diagnoses, and we'll do it with exclusionary differential diagnoses. Finally, we can use the quadrants as a treatment. Let's take an example where the quadrant is the only positive test. It's reproducing pain, the ovoid of motion is off as well. And so we can say that we've got a positive test for that joint, but that's all the information we're getting. Or we may be getting more information, but not enough for us to put together a treatment. We can use the quadrant to treat the dysfunctional ovoid. So let's assume that we can't, let's say it's flexion and radial deviation, like so. And if this is deformed and painful, then I can actually mobilize by coming up against the barrier and working out the barrier. Probably a good visual image of this is you're rubbing the pain away. So you don't hurt them. If you hit them too hard, you'll reproduce pain on this, and you don't want to do that because it's counterproductive. But you can smooth out the ovoid as it was. I have no real idea of actually what's going on, but this can be a very effective treatment, particularly when you can't do anything else. So that's quadrants. They are a useful test. They should be done properly. They're not particularly comfortable for the patient. Don't let that stop you from doing it though. These are among the more useful tests that we have. Anyway, happy quadranting and take care all. Bye-bye.